Hi, I'm Dr. Mitchell with Forest Lane Pediatrics, and today we're going to talk about swaddling a baby. Swaddle is one of the key techniques that we can use to calm a fussy baby, especially in the first few months of life. And there are 5 S's to calming a fussy baby. Those are detailed in the book Happiest Baby on the Block by Dr. Harvey Karp, and so that is an excellent resource to learn a little bit more about swaddling and these other techniques. But the 5 S's would be swaddling, sucking, side lying, swaying, and shushing. That's when you kind of make the shh sound. And so the swaddle, though, is probably one of the first things that we'll utilize right when babies are born to help calm them down and help them feel very secure and also like they're back in mom's womb, which is where they came from and where they like to be as far as that kind of cozy feeling. Swaddle also helps suppress the startle reflex, which is when the baby's arms kind of fly out from their body when they hear a loud noise or something kind of scares them, and that's often what wakes them up at night. And so the swaddle is actually really useful for making sure that a baby is going to sleep as long as possible at nighttime, which is obviously very valuable to any new parent. And many parents will notice that as we initially swaddle, sometimes the babies will fight against it and restrict it, which is actually pretty common, but not necessarily a reason to not swaddle. Once they fall asleep, the swaddle is often useful for the vast majority of babies to help them stay asleep and calm down. And so we have a nice, beautiful volunteer here that we are going to swaddle today. There we go. So here's my friend, and she's actually not too upset right now, which is a good thing. So to get started, we are going to lay her down on the blanket. We've folded this top corner down just a little bit kind of past her bottom here, and have a nice straight line up at the top. And we've placed her so that her head is just above the top of the crease. And now we're going to fold the arm down. Folding the arm down is helpful in that it kind of helps keep her from escaping. Hey there, I know. So we're going to wrap this around and give a nice tug. Once we've kind of got her in there, we'll just give a little tug there. And then we're going to bring this bottom corner up, again putting the arm down by her side, wrapping around the shoulder, and giving a tug. And then we bring this around to the center of her chest. We're going to kind of hold that there with our thumb, and then wrap around. Pull that underneath. Again, another good tug, and tuck it in. And then we'll just put a couple fingers in to just kind of lift up and make sure that she's got plenty of room there to breathe, so that it's not too tight, but definitely we want it nice and snug, as that is what helps her calm down. There we go. Good. Hey, good job.